Welcome to our lab on blood vessels. We are talking first about the arteries and then we'll proceed through the veins. Recall that arteries and veins are located next to one another and they are not separated from one another in the human body. So recall from our discussion with the heart that veins carry blood to the heart and arteries carry blood away from the heart. Here we can see in this diagram, we can see the pulmonary artery that carries blood away from the heart to the lungs, and the pulmonary veins that carry blood to the heart from the lungs. So remember that arteries carry blood away from the heart, veins carry blood to the heart. Typically veins are blue and arteries are red when we look at diagrams or models. However, this is not always the case in terms of the pulmonary artery and the pulmonary vein, because the pulmonary vein is red as it brings fresh oxygenated blood back to the heart, and the pulmonary artery is blue as it carries used deoxygenated blood from the heart to the lungs. So our first vessel that we're going to look at is the pulmonary artery, and that comes off the front side of the heart in the heart models, and then it branches left and right to form the two pulmonary arteries, left and right pulmonary artery. And then we have here just a review kind of the different vessels leaving the heart. Recall that we have the pulmonary artery carrying blood to the lungs. We have the aorta here that carries blood from the left ventricle to the rest of the body. And then we have the different veins bringing blood to the heart. We have the inferior vena cava down here, the superior vena cava up here, both leading to the right atrium. And then we have the pulmonary veins. Remember that there are 4 pulmonary veins and they lead to the left atrium. There's 2 shown on this diagram. The other 2 would be over here on the left side of your screen, but they're not shown in this diagram. Notice too that the aorta has several branches coming off of it, and then it dips down behind the heart, and we can see it coming down behind the heart here at the bottom. This is still the aorta. So we're going to proceed through the arteries. Looking at the aorta, here the heart has been removed. We can see that the aorta branches upward and has 3 vessels coming off of it. The first one on the left side of your screen shown here, this is the brachiocephalic artery. It branches out here to become the right common carotid and the right subclavian, but prior to this branching we call it the brachiocephalic artery. The vessel in the center here, coming off of the aorta, is the left common carotid artery. It goes up the left side of the neck. And then on the far right side of your screen, the last vessel coming off here is the left subclavian. And the reason why it gets the name subclavian is because the clavicle is here and it travels below the clavicle. So subclavian, referring to clavicle, running below the clavicle. Then the aorta continues down behind the heart in the chest cavity. So as long as we're looking at this vessel above the diaphragm, which is this flat sheet of muscle here, this is the thoracic aorta. And there's different vessels that come off of the thoracic aorta to feed the chest cavity, but you don't have to know those for our lab. But just know that this is the thoracic aorta. Then once that aorta passes through the diaphragm, it becomes the abdominal aorta. So this whole vessel here is the abdominal aorta. There's several branches coming off the abdominal aorta that you need to know. The first one is this large unpaired vessel here. It's called the superior mesenteric artery. So this is the superior mesenteric artery. What comes off of that, near the superior mesenteric artery, are the 2 vessels that supply blood to the kidneys, and those are the renal arteries. So each of these vessels here are the renal arteries, here and here. And then if we continue on down this abdominal aorta, the next pair of vessels that you need to know are the gonadal arteries. And these serve the gonads, which are the ovaries and the testes. So these are very long, thin vessels that continue on into the pelvic cavity to serve the ovaries or the testes. So we can see one gonadal artery here and the other gonadal artery over here. Again, serving the ovaries or the testes. And then this abdominal aorta divides right around the level of the hip, because we can see the ilium here of the hip, and these are called the common iliac arteries. Notice that they branch down here as they leave the hip, and then the name will change. But prior to that branching, right here, this is the common iliac artery, and this is the common iliac artery. So you'll notice that these names change depending on where we are in the body. The next slide looks at blood supply, arterial supply to the brain. If we look at the vertebral arteries, these run up the side of the neck. There's special holes in the vertebrae in the cervical region called transverse foramen that have the vertebral arteries, one running through each one on each side. So there's a pair of vertebral arteries running up the neck, up the spinal cord, and then when it reaches the brain, those two vessels come together to form the basilar artery. So that's this vessel here, the basilar artery. And then there's several arteries that come off this circular passageway for blood in the arterial supply to the brain, and this is called the circle of Willis. It's this rounded connection of several different vessels forming a circle, and it's called the circle of Willis. In the center here would be the pituitary gland. So this artery travels around, a series of arteries travels around the pituitary gland, and then here are the two bases of the optic nerves. So that's the circle of Willis, that circular structure. Then we move down the arm, so we're going back up to the heart. We can see here's the subclavian, and where the scapula and the humerus come together, this is the axillary artery, where the scapula and humerus come together. Remember that the axillary region of the body is the region of the armpit, so that would make sense that this would be the axillary artery. Then from there, as that vessel passes over the arm, this is the brachial artery over the humerus. This is where we put a blood pressure cuff to measure a person's blood pressure and heart rate, is over the brachial artery. And then as we continue on and follow along the lateral side of the lower arm, recall that this bone here underneath is the radius, so the vessel lying over it is the radial artery. And this is where we take a radial pulse. On the thumb side of the wrist is where we take a radial pulse. So that's a common place for taking pulse when you visit the doctor's office. And then if we continue down this abdominal aorta down into the leg, recall that the common iliac are these two arteries over the hip region, and as it passes through the hip region, it continues on over the thigh region. Here's the large femur, and this is the femoral artery, this large vessel over the femur. And that concludes the arteries that you need to know for the lab exam. So we'll continue on now looking at and comparing those to the veins. Many of them share the same name, except one is red in the diagrams and the other is blue, again except for the pulmonary artery and pulmonary vein where those colors are reversed. So starting with the neck, we see, first of all, the vessels coming off of the superior vena cava, which are down here. So this is the superior vena cava right here. And then the two branches of the superior vena cava are the left and right brachiocephalic veins. So this is a brachiocephalic vein, this is a brachiocephalic vein. Again, it will branch later on, but prior to that branching, we call these the brachiocephalic veins. Here we can see in a little better view, the heart has been removed, so here's the superior vena cava with the right brachiocephalic and the left brachiocephalic vein coming off of that. And then down here is the inferior vena cava, and that inferior vena cava continues on into the abdominal cavity. So this is all inferior vena cava here. If we go back to the brachiocephalic veins, we'll see that these veins pass under the clavicle just like they did with the arteries, and the name is the subclavian vein. So these veins are bringing blood back to the heart via the superior vena cava eventually. So these are the subclavian veins passing underneath the clavicle. Then if we continue back to the inferior vena cava, we see that passes through the diaphragm, and all this region here is still inferior vena cava, and there's two veins that drain blood from the kidneys, and those are the renal veins. So these are the blue vessels, the renal veins. Coming off of the inferior vena cava on the right side is the right gonadal vein, draining the blood from the ovaries and testes. And the left gonadal vein is unusual in that it comes off of the left renal vein. So this is the left gonadal vein here, coming off of the left renal vein. It's kind of an unusual attachment point, but it's pretty consistent from person to person. There are some exceptions, but This is the left gonadal vein coming off of the left renal vein. And then again, just like we saw with the arteries, this vessel, this large vessel in the abdomen divides to become the common iliac. So this is the common iliac vein, which drains the lower legs, or that drains the legs. Then if we look up in the abdomen, oh, I guess we don't need that picture. We'll go down into the leg here from the common iliac vein. We see the femoral vein here in the middle. The larger vessel running down the middle of the leg is the femoral vein. And then we have this large, unbranched, long vessel that runs down the medial side of the leg from the hip all the way down to the ankle. And that is the great saphenous vein. And this is a vessel that is commonly used to create bypass vessels to be used in open heart surgery for bypass surgery. They'll take small pieces out of the great saphenous vein to bypass clogged arteries over the heart. So this is the great saphenous vein, runs right down the length on the inside of the leg. And again, this is the femoral vein. And then if we move down the arm, there's a couple of vessels that we need to be aware of, and that again, the axillary vein is out here where the humerus and the scapula come together. So this is the axillary vein here, the larger one. And then that branches down. We can see down the middle of the arm. This is the brachial vein. Down the medial side of the arm is the brachial vein. And then there's a vein that runs down the lateral side of the arm. This is the cephalic vein. So we have the brachial vein on the medial side and the cephalic vein on the lateral side. And notice that those vessels come together. There's a special vessel that crosses over on the inside of the elbow, and this is the median cubital vein. This is a common place where we do blood draws. When a patient comes into the clinic and they need a blood sample, they'll draw blood from the median cubital vein. So when you think of arteries versus veins, veins are where we put medicines. We use many of these veins in the arm, anywhere from the wrist all the way up to the middle of the brachial region on the arm. We use those for inserting IVs and giving medicines and fluids. We also have central lines where we will put a IV in the neck, and the tip of the catheter for medicines goes right near the right atrium. So we're delivering medicines through veins because they're not high pressure vessels and they won't bleed continuously if we have to poke into them. Also, that medicine will be delivered to the heart to be distributed to the rest of the body, so it makes sense to put them through veins rather than through arteries, which will send that medicine directly through tissues. Also, arteries we use for measuring the function of the heart because the pressure waves in the arteries are created by the heart. Blood pressures are always taken over arteries. Measuring pulses, we're always looking for arteries. And that concludes our discussion of the blood vessels. Notice that there are flashcards that you need to produce of the blood vessels. There's a description and a copy of the flashcard documents on Blackboard. And you can also visit Dropbox to see a practice mini lab practical for the lab exam on the blood vessels.